Every claim tells a story, and some are stranger than fiction. Welcome to the F-Files. When claims get weird, we get to work.
Hello, everybody, and welcome back to the F-Files. I'm Mandy, joined as always by my partner in crime, Daphne. And if you're just joining us, this is a podcast where we talk about all things fraud, waste, and abuse. On our last episode, we examined investigations through the lens of state and federal agencies, commercial payers, and vendor SIUs with our colleagues Kate, Janice, and Savannah. And today, Janice and Savannah are back with us to do part 2 of that discussion, where we're going to explore how different regulatory agencies interact with each other when schemes span across payers. All right, so this episode is structured around a listener question from LinkedIn. Jana asked, can you explain the differences in investigation and prevention when Medicare is primary versus when Medicaid is primary? Specifically, I'm interested in minimum standards and limitations each entity is subject to as it might relate to any regulatory or compliance requirements. There's a lot to unpack in that question. Where do you guys think we should start with that?
That question sounds really complex, but I bet we can boil it down to a few key factors. Now, to be fair, I'm no expert in how other SIU departments run because the only SIU department I've ever worked in is here at Healthcare Fraud Shield. But luckily, I have some great colleagues who do have the experience to talk this over today. I think the overarching factor that determines how differing SIUs get to dip their toes into the claims data largely comes down to who the primary payer is. In this listener's question, 2 examples are given. The first is Medicare as the primary payer, followed by Medicaid. And the second example is if Medicaid's the sole primary payer. It's integral to understand first what the primary payer is. I think of the primary payer as the insurance company that's lucky enough to get to foot the bill for my claim. In the case of a member who's reached the age of retirement or who has a diagnosis that specifically allows them to draw on the benefit, Medicare gets the privilege of paying the bill first. I'm going to take a bit of a side path here because I'm curious. If a member has Medicare because they've reached the appropriate age to claim it, and they're still working full-time and their employer has a commercial plan, which coverage pays first?
I think you're actually raising a really good question, Daphne, because the rules around coordination of benefits and third-party liability are not something that the general public really understands. But to your question, typically the employer-sponsored plan would be primary and the Medicare would be secondary. So Medicare might pick up some or all of the remaining costs, like the deductibles, copays, coinsurance, if it's a Medicare-covered service. But there are some caveats to that. For example, the size of the employer-sponsored plan does actually matter. So if the employer only has fewer than 20 employees, then Medicare would actually be primary and commercial would be secondary. And healthcare providers and payers rely on coordination of benefits data to route the claim correctly. So it's really important for us as healthcare consumers to share all of our insurance cards when we go to appointments.
That's interesting. I guess I never thought of it that way, probably because I'm not old enough to have Medicare and a commercial payer. Thanks for indulging me for a moment while I opened a gateway into another dimension. Back to the original question. If a member has Medicare and Medicaid, Medicare gets the privilege of taking the first crack at the bill. Yay for them. Medicaid lives by a famous motto that I've become more accustomed to after being in an SIU department for almost 5 years now. And that is Medicaid is the payer of last resort. To me, that means everybody else gets to foot the bill. And if there's anything left aside for member copays, Medicaid would cover that for me. Do I have that right?
Yeah. For dual eligible folks, Medicaid's whole job is to cover those leftover Medicare copays and coinsurance so the member isn't stuck holding the bag.
Okay, so the third part of the question is what regulatory requirements and limitations should investigators understand? I'm basing this response on my interpretation of the regulatory bodies being Medicare and Medicaid. Mandy, I know you're an X-Files fan just like me, so I'm going to lead us on a visit down memory lane to see if I can make a fun analogy for us. Do you remember the episode where Mulder and Scully go undercover to move into a beautifully pristine neighborhood that harbors a horrifying secret?
I think you're referring to the episode with the really strict homeowners association and the passive aggressive neighbors who were freaking out about the portable basketball hoop. Am I right?
Yes, yes. And the moving boxes. Remember, the moving boxes had to be off the
Yes.
grass by 6 p.m.
And the burnt out porch lights were not allowed.
Yes. I totally forgot about that. You're right. Okay, so not only do they have an HOA, but their HOA enforcer is a massive garbage monster who travels underground within the neighborhood. And if you've been a listener with us since Mandy and I took over, you might recall my trick for spooky season decorating when it comes to HOAs. If you know, you know. If you don't and you have FOMO, you can go back and listen to episode 1. I think we can break this down into a logical explanation using this particular episode of X-Files as an example. For starters, we'll break this into 3 different stages. We'll call them the Mulder phase, the Scully phase, and the HOA or monster phase, whichever you prefer. We're going to start from the beginning when your member goes to see their doctor and the doctor generates a medical bill and determines who they should submit it to. In this analogy, the Mulder phase is going to be Medicare, which remember is the primary payer. So when the doctor submits the bill and Mulder gets the bill, he investigates the main issue to make sure it's accurate and applies to his policies and procedures. He pays most of the bill and then leaves the remaining balance for Scully to deal with, which, as we all know, is expected. The Scully phase, which would be Medicaid, relies on Scully reviewing Mulder's report, cross-checking the remaining balance against her own policies and procedures, and covers the rest of the bill if it passes the sniff test. Now, when I say reviews Mulder's report, what I really mean is she checks her own policies and procedures to make sure that it's applicable. Moving on, the garbage monster / HOA is there to enforce the laws of the HOA, which in this case is actually going to be the federal government. In this scenario, the monster prevents providers from veering off course of the arduously planned neighborhood guidelines and rules, better known in the real world as federal laws. If any provider attempts to stray from the HOA handbook, they're going to be dealt with accordingly. Okay, so if you followed me this far and fully understand what's happening right now, congratulations, you might also be a nerd. Mandy, can you break this down for those nerd-adverse people out there?
I'll try. So, in short, you're saying Medicare is the primary payer. It reviews the claim, applies its fee schedule and coverage guidelines, and pays its share first. And then Medicaid steps in to cover eligible remaining out-of-pocket costs. But I do want to tweak that analogy just a tad bit. So we almost have to say here that there are 2 different HOAs in this scenario. So we have the Medicare HOA and we have the Medicaid HOA. And they each have their own regulations and their own enforcers. So in this analogy, there would be a street in this neighborhood where the HOAs overlap because the street has both Medicaid and Medicare members. So the garbage monster for the Medicare HOA fines the homeowners for having a pink flamingo in their front yard, but it doesn't bother alerting the Medicaid garbage monster of the violation. And because of this, the homeowners remain in good standing with Medicaid HOA because they never know about the infraction. So basically what I'm saying, and I think what you're kind of getting at too, is that the primary and the secondary payers don't necessarily communicate with each other.
Exactly, that's what I said.
Okay.
And also, I would hate to be a resident on a street that has overlapping HOAs. Like, that would literally be the worst.
Yes, it would.
Okay, so now that we have an understanding of the billing process and the cycle the bill or claim must go through to be paid, let me pitch a question to our guest panelists today. When each entity is looking at the same claim and the claim gets paid in a specific order, what effect can that have on fraud detection opportunities? And as a follow up to that question, how would each type of payer, commercial, Medicare, or Medicaid, go about investigating and determining their liability for the claim?
So I think maybe just to give this question a little more structure, I'm just going to throw out a scenario. So let's just imagine Operation Gold Rush, where a Shell Durable Medical Equipment Company billed Medicare for urinary catheters that were never ordered or delivered. Because Medicare is often set up to auto pay routine claims and they rely on post pay audits, their systems will blindly process those claims and issue payments. But then, because the primary payer signed off, the state Medicaid program, looking at the crossover data, assumes the claim is legit. And the automated coordination filters that see Medicare paid its share sort of indicate to the secondary payer to pay its portion of the bill. And this doesn't usually get noticed. Downstream, it really isn't questioned because the primary payer gave the green light on that. So, what happens if the secondary payer, in this case Medicaid, identifies these fraudulent claims before Medicare does? Are they able to recover their overpayment even if Medicare didn't? And do they have to notify Medicare of their findings? I think probably the best person to answer this question would be Janice because she has a little bit of experience with Medicaid.
Yeah, thanks for having me back, Mandy.
You're welcome.
So, while Medicare's payment determination often does influence downstream processing by other payers, it does not prevent Medicaid from conducting their own investigations or making their own recovery determinations. When a fraud scheme affects both Medicare and Medicaid, state agencies, MFCUs, otherwise known as MFUCUs, and Medicaid fraud control units, along with CMS contractors and other federal entities, they often share information and coordinate investigations. However, the specific reporting obligations do depend on applicable federal requirements, state laws, and other contractual provisions these entities might have. So, a state Medicaid agency generally does have their own independent authority to recover their payments. And, when they determine that an underlying claim was improper or fraudulent, they can recoup those dollars, even if Medicare has not yet issued an overpayment determination. In a crossover scenario, Medicaid's payment remains contingent upon a valid underlying service. So, if Medicaid investigators determine that services such as urinary catheter supplies weren't ordered, weren't provided to the members or recipients, or weren't medically necessary, the state might pursue recovery of its portion of the payment, regardless of what Medicare has done or will do. Managed care organizations, otherwise known as MCOs, they also conduct their own independent reviews and investigations. However, if they suspect any fraud or anything that's a little bit higher level of abuse, they are often contractually obligated to refer their findings to their state Medicaid entity and await further direction regarding how to proceed. Some states also require referrals for suspected abuse, although those requirements will vary by state. Each state's Medicaid is slightly different. It's up to the state. Because MCOs frequently serve dual eligible members, they may investigate potentially improper claims regardless of the line of business involved. So, MCOs can generally proceed with recovery of any identified overpayments, except in those situations where their state Medicaid entity has told them to kind of hold off. So, just to kind of sum everything up, while some payers have contractual obligations to report any FWA findings, not all do. At times, these differences in reporting requirements can create communication gaps, and that can be problematic. It allows billing patterns or bad actors to go undetected. So, ultimately, When a service has been paid by multiple payers, it's a good business practice to notify other payers of significant FWA findings so they can conduct their own reviews. Um, by kind of collaborating, we reduce the silos that we often feel in this industry, and collaboration is just kind of key to making sure those bad actors have a bright light shined on them. So, yeah, that was a great question from our listener.
Beautiful. Thank you for that, Janice. That was really, really helpful. And Savannah, you have a little bit of background with commercial payers, so could you chime in with a commercial perspective?
Yeah. So, from a commercial payer perspective, the approach to a shell DME company billing for stuff that was never ordered or rendered may look a little bit different than from a federal programs perspective, because commercial plans are generally focused on protecting like the plan assets itself. So, ensuring claims are paid accurately, timely, appropriately, and enforcing terms of their contract and their plan benefit, um, rather than like federal payer guidelines. So, like we had talked about, a lot of people would probably assume that if the prior primary payer approved and paid a claim, everyone would then follow along. And from a commercial payer perspective, that's typically true. But if something later raises a red flag, the commercial health plan still may decide to take a second look rather than just rely solely on that primary payer's determination. So, a big distinction often comes down to whether the commercial plan is the primary or secondary payer. Because if the commercial plan is primary, they can do more prepay. And if they see inconsistencies in the data or anything, they can request records beforehand and do more of an audit. But when they are the secondary, they typically do rely on that primary payer's approach. And if they are relying on that primary payer's approach, they need that red flag or something coming up later down the road, to prompt that review. So it's kind of like being the second person to proofread a document. You assume the first reviewer caught everything, like the major issues, but that doesn't mean you're going to ignore something that clearly doesn't look right. So, in many cases, the secondary payer needs something to prompt that closer review, like I said. Typically, from my experience as a commercial plan or working at a commercial plan, was that it was typically a member complaint. Sometimes it was an audit finding or some other indicator that warrants a second look. But honestly, most commercial investigations I worked on started with something just super simple, a member phone call, and sometimes bigger and badder investigations started because of it, because a member would call and say, "Wait, I don't think that's right." And in the Shell DME company example, a member may call and say, "I never got these supplies. I don't recognize this company. I never ordered anything." And that single conversation can become a catalyst to a much deeper review. So commercial plans don't always do things that those federal plans do, like uncovering concerns through algorithms or large scale audits. It's typically members and claim specific. So sometimes the member is the first line of defense. Um, and after all, they are the one person who would know whether that box of supplies ever showed up at the house. So at that point, the commercial plan can do a review. Typically, they're relying on that primary payer's decision, but usually when the secondary plan would come into play and would do an investigation themselves is when a member's saying, "I didn't get this," or "something's wrong," or if there's a referral from an outside entity. So ultimately, payment by the primary does not automatically guarantee that the commercial secondary payer will review the claim and say, "Yes, this is appropriate." And I have certainly seen cases where the conclusion was the primary payer allowed it, so we'll allow it. But that's not always where the story ends. Commercial plans often have a degree of wiggle room to ask questions and validate the claims, request records, and make sure that payments align with both claim accuracy and payment integrity expectations. So Yeah, it's definitely, if they are the secondary payer, they usually typically need something to prompt their review, but they will still review.
This was great, ladies. Thank you so much. So, if we bring this all back to Jana's original question, what we learned today is that there really isn't a one size fits all answer. The investigation may involve the same claim, the same provider, even the same member, but Medicare, Medicaid, and commercial payers may each approach it differently. But the good news is that when payers share information and work together, those differences can actually become a strength instead of a weakness. Janice and Savannah, thank you so much again for joining us. We really appreciate you sharing your experience and your expertise. And thank you to Jana for inspiring today's discussion with a fantastic question. This wraps up today's episode. And just a reminder of some upcoming Healthcare Fraud Shield events. We'll be attending the HPRI Medical Cost Containment Series in Chicago, Illinois, September 9th through 11th. If you're attending, meet with our team to learn more about AI fraud detection and other integrated solutions. As always, Healthcare Fraud Shield will be attending the NHCAA Annual Training Conference in San Diego, California, November 3rd to the 6th. Our team loves connecting with you at this event every year, so please come by and say hi. You can also find our team at the Alliance for Health Policy Forecast Symposium in Washington, D.C. on November 12th. And last but not least, we're looking forward to our third Healthcare Fraud Shield Elevate User Conference in Denver, Colorado, April 20th to the 21st, where we team up with payers, investigators, compliance leaders, and tech innovators for 2 days of insights, training, and collaboration. This event is free to attend, so please don't miss it. Talk to you next time. Everything that has been discussed in this podcast is based on our day-to-day experiences.
Any opinions stated by myself, Mandy, or any guests during the podcast are not necessarily representative of the opinions or views of Healthcare Fraud Shield.